Welcome. This is Joan Miller. I want to welcome everyone to our 2020 Harvard Ophthalmology Annual and Alumni Virtual Meeting. I'm really pleased that so many of us are able to gather virtually, alumni, current faculty and trainees, our 2020 graduates and friends of the department. I want to congratulate our newest alumni, the graduating class of 2020. Thank you so much for your hard work, flexibility, and resilience during these extraordinary times. We have an exciting program for everyone this morning, highlighting our department's innovative response to the pandemic and our adaptation going forward, and leading into a session with our famous alum, class of 1975, Robin Cook. I will give a modified state of the department to kick off our meeting, but first I really want to thank the team who has brought this all together. Our annual meeting co-chairs, Jenna Hadari and Rachel Huckfeld, and our Harvard Ophthalmology alumni directors, Joe Rizzo and Joe Ciolino. And of course, Christina Stetson, Julie Dutcher, Bonnie Brodowski, and the Ophthalmology Communications team. I also want to thank all of our affiliates for their continued support of this meeting. Although words are never enough, I want to offer support to those who are struggling in this time of fear and unrest. Now more than ever, it's important to affirm Harvard Ophthalmology's commitment to advancing racial and health equity. Building a culture that is diverse and values inclusiveness is essential to us. Our strength as a department and community is rooted in the uniqueness of our people. We need to celebrate and respect different points of view, and we should remember to be thoughtful as we listen and learn from each other, even when that is uncomfortable. Finally, it is important that everyone feels safe, feels valued, and feels engaged within our community. I want to take a moment to honor 3 faculty members who passed away at the end of 2019 and in early 2020. I have previously communicated about their careers and contributions. Let us pause in a moment of silence for our colleagues and for any family, friends, or colleagues lost in recent months to COVID-19. Well, everything changed very rapidly for us in mid-March. This morning's speakers will describe this in more detail, but in clinical care, we immediately reduced to urgent and emergent patients only while keeping all of our sites open. Research was cut back to only essential activities in order to maintain key animal strains and other essential needs. COVID-related research, however, continued, and we will hear more about one program later from Luke. Our faculty and staff have been working remotely, lots of manuscript and grant writing going on. In education, our residents were pulled from clinical activity to cover urgent care across the system. All academic activities became virtual. Well, this is what we thought we'd be talking about in 2020. And of course, the year 2020 is a key one for anything related to vision and ophthalmology. And we are still continuing somewhat to celebrate in events and communications our accomplishments and looking to the future as we work together to eradicate blindness. Let's give you some updates on the department itself. By the numbers, as you know, we have 9 affiliates and 3 international partners. We have 261 full and part-time faculty members, 179 trainees, including ophthalmology and optometry residents, clinical fellows, and postdoctoral trainees. At Mass Eye and Ear alone, we had $33 million in direct expenditures on research in FY19. We continue to recruit across the department, and really the faculty are certainly our engine for innovation. You can see our increasing numbers of faculty and our large number of trainees. We've had some key recruits this past year. Michael Lynn returned after fellowship to join the glaucoma service. Brenda McCarthy joined us from Leahy Clinic to join the Comprehensive and Cataract Consultation Service at Mass Eye and Ear Longwood. Anna Stagner is returning to Mass Eye and Ear, now having completed 2 residencies and 2 fellowships, and she will be directing the eye pathology service at Mass Eye and Ear. We welcomed Prashant Yadav back to the department as a hospitalist at Mass Eye and Ear in April, and in July, he will take over as medical director of the ophthalmology consult service at Mass Eye and Ear. We have additional recruits coming in 2020, as you can see in the glaucoma service and retina service, And I'd like to point out two of those faculty, Drs. Vu and Dr. Patel, are joint between Mass Eye and Ear and Boston Children's. We're also recruiting on the cornea service, ophthalmic plastics, comprehensive ophthalmology service, and two recruits who came in 2019, pediatric ophthalmologists to Boston Children's. I'd like to acknowledge and announce some leadership appointments. Matt Gardner as Associate Chief for Clinical Affairs at Mass Eye and Ear, Alice Lorch as Associate Chief for Quality in Research, Lucia Sobrin, Associate Chief for Clinical Data Science, and Jim Chodosh taking over from Dr. John Lowenstein as Associate Chief and Vice Chair for Education. We continue to do well as a department in honors and awards, both nationally and internationally. Dr. Aiello was to have given the Friedenwald Award at ARVO, and that has been postponed to 2021. We've had two faculty members, Tony Adamus and Elizabeth Engel, accepted into the National Academy of Medicine. Peter Baranov received the Arati Award for Research in Retinal Diseases, and Pat DeMori received the Roger Johnson Award for her work in macular degeneration. We are, as I said, celebrating our highlights across our tripartite mission and reviewing some of our major discoveries and milestones and achievements over the past 20 years, as well as sharing our thoughts about future directions. You should have already received the first edition on research in, I believe, January. The education edition will be coming out shortly, and there will be a clinical edition in the fall. To just mention a couple of clinical highlights over the past year, there really has been a lot going on, but I think telemedicine was a program that we had initiated over the past several years with e-consults and some screening programs, but really with the COVID-19 pandemic that has greatly accelerated the adoption and use, and I would say our pedals to the metal in that area. We're going to hear more from Matt Gardner and Ankur Shah on this. We've had some nicely renovated and expanded clinical space, including an expansion at our Mass Eye and Ear Longwood site, and a really lovely new clinical area for the retina service in the main building at 243. We've had exciting advances in research across the department, and I'll just mention a couple. One being work by Ulrich Kunis to improve our understanding of the pathogenesis of Fuchs. And the team led by Joe Arboleta discovered a mutation that was protective against Alzheimer's disease. And this has implications in terms of understanding Alzheimer's, but also other neurodegenerations. On the education front, we've continued to innovate, and for the past year, we've had a monthly workshop series called Innovation and Interaction Sessions, where faculty work with residents in the ultraocular surgical training laboratory in a focused area of surgery, either in cataract or in the subspecialty areas. We have also continued our initiatives to increase diversity, equity, and inclusiveness, both locally with the Harvard programs, but also collaborating with the American Academy of Ophthalmology and the AUPO. These efforts are led by Jim Chodosh and Ankur Shah. We're also working towards integrating our PGY 1 year, which will start next summer. Well, in terms of looking to the future, I would direct you to your eyewitness editions. Those are a great, better source of information. But just briefly, in thinking about clinical care, I think we have an increased emphasis on the patient experience. I believe telemedicine, as we'll hear, will be further expanded. And in general, I think we're working towards more patient-centered care with things like home-based OCT and other point-of-care ability. In the research realm, I think we are clearly in the era of big data and using that to answer different kinds of questions. We will continue our successes in genetics and gene-based therapy, as well as exploring new imaging and other diagnostic technologies. Our educational focus will certainly have a large effort in diversity, equity, and inclusiveness, and we are always working to improve our learning to make it more interactive. And we all are working towards encouraging and fostering a supportive environment really for everyone, but especially for our trainees. We're all very grateful for the continued support of our donors, and Mass Eye and Ear is very far along in its $250 million goal, of which $100 million to date has been for ophthalmology. We've recently received two bequest intentions, one a $10 million bequest for research in macular degeneration, and a $2 million request from a patient of mine to endow a Mass Eye and Ear chair in ophthalmology, but with an interest in cornea. Our Alumni Giving Society just started in 2010, but we've raised nearly 17 million to date. And of course, we're very grateful for the wonderful gift from Fred Jacobiak, which will create 5 named endowments at Mass Eye and Ear. Well, this is a picture of us from last year's AMAR, and I gotta say, I really love these pictures. And perhaps we all took them for granted. And I really look forward to the time when we can all stand shoulder to shoulder again and doff our masks. Thank you very much.